Hi, I'm Shirley Osmond. I'm a patient of Dr. Rivera's at SEMA, and I'd like to tell you a little bit about my surgery here and what the results have been. Our immediate intent was to try to get our health in order. At the time I weighed, and I didn't weigh myself often, I weighed somewhere around 315, 320 pounds. And I was also diabetic, I had hypertension, and I was having problems with one of my knees for the first time. And I had been overweight half my life, since the age of about 35. So it's amazing that I didn't have orthopedic problems before then. So there had been some effort on my part prior to coming to Costa Rica to address the weight issue. I had gone to Duke University through their program. I'd gone to Shelter House through their program. And I'd gone to several bariatric surgeons in the United States who turned me down. They said, at your age, I was 60 or 61 at the time, you're too big of a risk. The weight, your current weight, the fact that you're diabetic, the fact that you have hypertension, there's just too many risk factors. Also, in the United States, my husband and I were self-employed as manufacturer's reps, and we paid about $25,000 a year for our health care with United Healthcare, and that came with large deductibles and a lot of restrictions. And even though United Healthcare covered bariatric surgery if you were morbidly obese, which is what I was, they turned me down and never gave me a good reason why. So I focused on the 3 largest private hospitals in San Jose, and I actually requested to interview the chief surgeon for bariatrics at each of those 3 hospitals. And as it happened, Dr. Rivera was the last of the 3 that I saw. And I knew as soon as I met him and we talked that I need not go any further. Not only does he have great credentials, he studied in the U.S. and Costa Rica and in other countries, and he's a sought-after speaker on the international circuit for his areas of expertise. And when I met him, it was the person. He has such passion for what he does, and his facial expressions, the brightness in his eyes tells you that he's real and that you can believe what he's telling you. I like the fact that he had a conservative approach for me. At the time that I first saw him, I was 61 years old and weighing 315, 320 pounds. And he said, I'd like for you to lose about 30 pounds so that I can present your case to the board. He said, because you do present some risk factors. And I said, well, I can do that because I feel certain that if I do it, you'll take me on as a patient. And that's what I did. It took me a couple of months to lose 30 pounds. I came back and he did exactly what he said he would do. He went to bat for me with the board, and I was scheduled for surgery. I had my surgery around August 1st, 2010. And over the next 14 months or so, I lost almost 160 pounds. And that's pretty much where I am today. I've stabilized. I still want to lose another maybe 15 or 20 pounds. But I'm pretty happy because I started at a size 26 dress, and now I'm a size 10 in almost everything. So I'm very happy with that. Even my shoe size changed. I went from an 8.5 to a 7. My wedding rings fell off, so I'm not going to have them resized until I'm at my goal weight.